Hey guys, Dr. Jordan here with Sports Chiropractic of Utah, your health, performance, and wellness specialist. We have a very special episode today. Very important person. Most important person in my life. What's your name?
I'm Bonnie.
Hi, Bonnie. Nice to meet you, Bonnie. How do you know me?
You know.
You're married.
We're married. I kind of like him.
Yes. I win. I paid her to say that, but it's cool. Anyway, you guys, so we're talking about shoulder impingement this week, and Bonnie has a unique case we'll talk about in a second, but we're going to demonstrate one possible method of treatment for shoulder impingement. Remember we talked yesterday, shoulder impingement happens right here at the tip of your shoulder, but most of the mechanics are found in the back of your shoulder and the shoulder blade muscle. So we're going to demonstrate cupping. Many of you have seen this before. Many of you have heard of it. Maybe many of you have tried it. Who knows? But we're going to demonstrate how we do cupping and the whys behind cupping. Why we do it, what it's beneficial for, and how we do it. So let's just jump right on into it.
Maybe we should say why we are where we are. This
Maybe
isn't
we should
his
start
normal.
over. No, we won't start over. One take. By the way, I completely forgot. This is an at-home visit. I only do it for one person. This VIP. We're actually in Bonnie's work, a.k.a. the basement of our home.
This is where I live.
Yeah, this is where she lives. She does LuLaRoe. If you haven't heard of it, I will tag her in the video so you can check it out.
Come shop at our house.
Come shop at our house. Open invite. But yeah, anyway, so yeah, I forgot we're kind of in a completely different environment. So, hence the new look. The office has not changed. I'm just mobile tonight. This is the only way we can really coordinate our schedules to do this video. But the reason why I wanted to use Bonnie is actually because she had a very specific problem several months ago. So we'll talk about that more in a little bit. But let's demonstrate. Bonnie, let's go ahead and go face down for me. Let's put some of these cups on you. So, all right, Bonnie, in your own words, what happened to you? Nice and loud.
I don't know if you'll be able to hear me down here.
I'll tell you because you probably won't be able to hear. So, just so you know, I'm putting several cups right along the inside border of her shoulder blade and kind of on the bottom as well. Okay, because what we're trying to do is we want to wake these muscles up, because we talked yesterday, those shoulder blade muscles are very, very important to work properly to clear your shoulder from the bony roof that we talked about yesterday. If you have not watched yesterday's video, please do, so you know exactly what we're talking about. So anyway, that's why I'm doing it. But it was, gosh, how many months ago was it now? I don't know, April-ish, March, something like that, a while ago. Bonnie developed a fever, kind of out of nowhere, and that fever ended up, long story short, turned into brachial plexus neuritis. What that is the virus from her fever, whatever illness she had, ended up attacking all of the muscles in her neck and even in her shoulder blade. Hospitalized her for several hours, excruciating pain. Her face went numb, her arms were numb. We were thinking she was having a heart attack, for heck's sake. It was crazy. Long story short, she gets out and she develops a lot of weakness. And actually, along the shoulder blade area, there was one nerve, the long thoracic nerve, that was affected. She couldn't raise her arm fully above her head. She was having a lot of pain back here. And actually, that muscle behind her shoulder blade started to waste away as well. Kind of crazy. But with the miracle of time, first of all, but we cupped it, gosh, several times, right? We adjusted her
after, too.
Shortly after we did. We adjusted her mid-back, her neck, did everything we could actively to get her shoulder, her arm feeling a lot better. And it took a little bit, but it actually, sometimes the recovery from that type of problem can take up to a year. And I think about in 3 months, you were back to normal, right?
Yeah, ish.
Roughly. She still deals with it a little bit. That's actually why I wanted to do it on her again. But you'll see, it's nothing. How does it feel?
I like it.
She loves it. Some people
weird.
say it
That's
sucks.
probably weird, though.
Is that funny? That's funny. See what I did there? But no, I get a lot of people saying that it's a weird sensation, but it does feel good. And I do it to me actually quite a bit as well. But what it does is it recruits more blood flow. That blood flow in turn helps reduce a lot of muscle tension. But I also like to do it for those whose muscles are not working properly or are just not firing the way that they need to. I put this on here. We're stimulating the area, bringing, again, more blood flow to it, so it almost wakes it up, like, hey, you know what, do your job. This is considered a passive modality. What that means is she doesn't have to do anything. She just sits here and does it. it's very important after we do these passive modalities that she actually gets up and does some active movements to then engage those muscles. It's not enough just to do this, but I like to do this. We've been on for about 4 or 5 minutes. For the sake of time, we'll stop now. But
how come you're wiggling it?
So this is probably my own thing. I like to wiggle them. That's a great question, patient. Thank you for asking. I appreciate
You're
it.
welcome, doctor.
But I wiggle these just to stimulate it just a little bit more. That's my own nerdy thing. I don't know if it's even something that everybody does, but it's something that I like to do just because I'm trying to wake an area up, especially for her. So I wiggle it to stimulate it even more. So that's the only reason why I do that. So then we take those off after about 4 or 5 minutes. They leave some good marks sometimes. She bruises pretty easy. But yeah, so that's cupping. That's just one possible thing. I cup on a daily basis. I don't know if there's been a day that's gone by very often that I don't utilize this technique because it has worked over and over and over for sore muscles, for even some muscle strains, some achiness. A lot of desk workers will get pain right through this area, so we'll throw that on there. It's been amazing, the results that we've gotten with cupping. So just a quick little demo of cupping. One possible treatment that we use. You can do whatever you want, patient. Do it. But one possible treatment method of in our office for shoulder impingement, or at least working with the biomechanics of shoulder impingement. If you have any questions, comments, leave them in the comments. That's a good push-up. Well done. But give us a call. If you know of someone that could really benefit from this, tag them in the comments. We'd be happy to help them out. Thanks for tuning in, guys, and stay tuned for tomorrow's episode. We'll talk about one movement and one stretch that you can do to help with impingement. So thanks for tuning in, guys.